the biggest problems facing the cardiology community and the hospitals in which they practice is the high readmission rates for conditions like heart failure and acute MI. Now, the ACC's Hospital to Home initiative is designed to try to improve the care of patients as they transition from the hospital to home and thereby reduce the unnecessary readmissions. Joining me to explain this initiative are Dr. Mary Norine Walsh, who we'll call Minnow, if that's all right by your real name, and Dr. Harlan Krumholz. They're co-chairs and leaders of the ACC and the Institute for Healthcare Improvement's Hospital to Home initiative. Thanks both of you for joining me. Harlan, let's start out. What is the H2H initiative?
Well, the H2H is an attempt to find a solution to this problem in medicine that we've uncovered, that virtually 1 in 5 or 1 in 4 of the patients that we discharge from the hospital end up back in the hospital within 30 days. And we thought we just can't stand by on this issue, and we need to really bring together a community of clinicians and organizations and take in the patient perspective and try to figure out what can we do to focus our attention, learn together, and address it, solve this problem. So
it's a tremendous financial and management or care burden, and then this readmission thing. So that's what the whole initiative is trying to do, is figure out a method on how to solve this.
Yeah, the idea is that, first of all, it's a big burden on the patients.
Sure.
And then secondly, for our healthcare system, this can result in wasted dollars and unnecessary expenditure of resources.
Right.
And if we were just smarter and better able to help this transition from being in the hospital to home, we'd be helping everybody.
Minnow, let me ask you, there's some interesting terms with this. There's the H2H challenge and a toolkit I hear about. What's that about?
So Randy, one of the things that we've realized through H2H is that what we really need to do is look at the research in congestive heart failure and acute myocardial infarction transitions and see what we can do with that research to help put the research in the hands of the institutions and the care providers. And those challenges are going to be focused on evidence-based tools. And for example, the first challenge, which we've launched just recently, is what we've entitled See You in 7.
See you in 7.
Because what we've known from the research is that if patients are seen early in follow-up after a hospital discharge for heart failure or acute MI, they do better long term. And so what we're challenging the participants in H2H is to look at their discharge process and see if they can get their patients to be seen in follow-up in that first 7 days.
That's cool. And what about the toolkit? Is that part of the challenge?
It is, and one of the unique things about H2H, and it's similar to the ACC's previous Door to Balloon campaign, is participant involvement. So we're not just, as leaders, dictating what you need to do in your institution, but asking, what is it that works for your institution? How could you help the other participants? So the toolkit will literally be made by the participants, as we're currently asking what works at your institution.
Well, that's cool. Harlan, what are the lessons that we've learned to date about? We must have learned a tremendous amount of lessons in this program.
Well, we haven't. I think primarily we've learned that we need to have the perspective that discharge isn't really an end, and for the patient, there's the experience of an episode of care, and that we as clinicians need to think about this transition, this very sort of hazardous, dangerous period,
sure,
where they're leaving a high degree of surveillance and monitoring into the home environment, and what can we do to ease that transition? So first, it's an awareness, it's a perspective, an approach. And then secondly, in terms of facts, well, there's no simple recipe, which is in one way why we're trying to build this community where we're learning from each other. That being said, I think there's some simple things that aren't being done very frequently that we can try to implement. One has to do with better management of medications. Do patients know their medications, and can they get them? Are we clear about that?
Right.
Two, and as Minnow said, our first challenge is going to be, do they have an appointment, and can they get there? And is it going to be a high-quality appointment? Because there's been good information exchange across so that they're ready and the clinician's ready to make sure that it's a substantive interaction. That's not happening so much, and we're going to focus on that. That's our first challenge. And then, finally, there are areas here where we can know that we can increase and improve the communication, in which we can try to make sure that they know what are the symptoms that they should be worried about. Often people go home, they're confused about, well, if I'm feeling a little bad or a little short breath, do I need to call, or they're embarrassed about calling? We need to be very clear with them about what are the signs that should trigger them to say, hey, I'm wondering, I want a little more direction. And how can we make it easy so they don't feel inhibited from reaching out? How can they know the right things to do? So that communication about instructions and what they can do are our 3 central tenets.
I mean, it's absolutely, it sounds like a fabulous program, and certainly one we need. How can people find out about this program? Where do they go to find out?
Well, they can go on the ACC website for one, and really getting started with this, if your hospital or your group's not involved yet, is very easy, and there's some kind of basic things, and we'll help walk you through it. Just looking at your own discharge process, looking at who your champions are in your hospital. Can you be the champion?
Right.
And it's definitely not too late to get involved.
So is there a website?
Well, let me just be clear about this. So H2Hquality.org, people can come on. We already have more than 1,000 hospitals.
Right.
We have almost 2,000 individuals who have joined.
Fabulous.
The value of this is going to be in the participation, not in pushing out information, having people be inundated with new things, but having them actually participate, share, and be part of this effort to actually solve this problem.
So it's really interactive. I mean,
Very much so.
And it sounds fabulous. Well, it sounds like a great initiative. Thank you both for joining me.
Thank
Thanks
you very
for having
much.
us.